there, my name is Mary Stern and I'm a physiotherapist. I'm coming to you here from North Vancouver and I am showing you clinical Pilates from a physio perspective, and I'm using myself as the patient today. It's really important to know that with clinical Pilates, it is not an intimidating practice where you need to have any experience with Pilates. It's a way to treat your injury that is going to help you with novel movement in a way that you might not otherwise be able to do. So novel movement, changing movement is transformation, and we use the equipment and we use some of the principles to really find those sweet spots where we can allow your body or support your body in transforming, getting stronger, better tension, length, and helping just to work out maybe that last little bit that you need for your optimal performance or to get rid of your chronic pain. So here we go. So today what I'm going to do is to show you an exercise that I use to treat an injury that I have that is related to a skiing accident, but that is essentially some biceps tendinosis, so a little bit of an issue with the tendon of the biceps. And so for me, what sometimes will happen is I will get a little bit of discomfort here in the anterior side. I do have strength and stability in the back, but it definitely needs to improve. And so here what I'm going to show you is some triceps activation, as well as keeping that stability through the back and my external rotators, and then finding some nice alignment for my shoulder throughout. You'll also see that I have to activate my obliques and find my core stability throughout. So this is really wonderful training for me and helps me to activate and strengthen an area that can sometimes present with a little discomfort, weakness. If I try a 3-point shot right now, forget about it. So that's my goal, to be able to do threes again. Which, full disclosure, I haven't actually done in about 10 years, but now that I feel I can't, well, you better believe I will. So here we go. So I'm going to grab this push-through bar here, and I can come from like a little bit of a further vantage point. So actually I will just sneak out here a little bit. And so you'll notice what I'm trying to do through here is find my scapular stability as well, without over using my lats, which I tend to do. I'm just going to find that little bit of downward rotation. And now this may be language that's familiar to you, maybe something that's not. Don't worry, your physiotherapist or myself, if you're working with me, will just guide you through this. The important thing is that you find this movement, you find that nice warm sense of activation, and that yes, you were able to do that. So as I move through this movement, what I want to think about for me, for my body, is that I'm not internally rotating. This is partly what I'm trying to correct. I do tend to do a little bit of internal rotation, a dumping forward of that shoulder, which my biceps tendon does not love. So we are supporting that posterior shoulder strength and stability, and it's not actually no work for me to stay upright through here. That's one of the things that you'll find when you start working with me with clinical Pilates is that we really are, sometimes the effort is actually in keeping this part stable. And if you think about some of the sports that you do, whether that's badminton or whether you're a cyclist, having that stability through here is really, really key to preventing injury and to helping you do the distance and the rigorous exercise that you like to do. Or I don't want to paint a picture that this is only for athletes, because truly this is suitable for everyone, and really it's up to your physiotherapist to cater it towards you. So you should never feel in a session like you're intimidated, like you've done something wrong, like you're being scolded for anything. And I know that you most likely haven't or wouldn't imagine that you would be, but it's important to know that correction is not what we're all about. It's really about facilitating movement that's going to strengthen you. So right now I'm feeling really nice little burn through my triceps. This position, I am also aware that if I do it for too long, get a little nervy. So I'm just mindful of that, just staying on my edge. So for you, I'll be asking you, do you have any tingling happening through that area? And if you do, we might change the position of your alignment, or we might just pace and stop altogether. And you'll notice that my wrist doesn't stay stuck, because if it did, would be very uncomfortable for me. So that wrist mobility is key as well. Good, so I'm really feeling a nice warmth back of shoulder. Notice I keep my elbow forward for the most part. I bring that elbow down without allowing that shoulder to come up. So a lot of principles together, and truly a full body movement from the trunk up, although my feet are engaged and planted on the floor too. So you might look at that as that hip stability. For some people, this might be a hip stability exercise. They might find that it's difficult to keep one hip down or the other. And that's just where this becomes a part of our discovery. And we try the best we can to translate that to functional movements that you're trying to get back to. And that's where that sort of mystery and unraveling and peeling back the layers of the onion comes into being. So I get excited about that, but mostly I get excited about your results and mine. So this has been a clinical Pilates session with me as the patient and me as the therapist. And I hope you enjoyed it. If you have any questions, please comment below. And I hope you book with me. Thank you.